All right. Hello, everybody. Welcome to another segment of For the Health of It, our new segment on health and wellness dedicated to getting important information out to you and to our community. I'm your host, Dr. Trevor Kinlock, and today our topic is understanding breast cancer. As all of us know, this month is Breast Cancer Awareness Month, and so we wanted to bring on a special guest to talk about breast cancer so that we can all have an understanding of that. Perhaps we have friends or loved ones, but it is important for all of us to know because we never know when we will certainly need to have this information either for ourselves or for someone that we care about. And it would be good for us to be of support. So our guest today is Dr. Jonelle Samuel. We welcome you, Dr. Samuel. She is a board certified obstetrician and gynecologist. She also serves as assistant faculty for the residency program at Anne Arundel Medical Center, and she is the division chief for gynecology at Doctors Hospital. She has a special interest in minimally invasive surgery as well as fibroids. So she comes well qualified to speak on this topic today. Dr. Samuel, welcome. It is good to have you. How are you?
Thank you. I'm doing well. Thank you.
Good, good. Well, can you talk to us today? Who is at risk for developing breast cancer?
Yes. So in terms of who is at risk, so anyone who has breast tissue is at risk. So that means not only females or women, but also men are at risk for breast cancer. But in particular, when we think about risk factors for breast cancer, we want to categorize them into two different groups. So I look at them as modifiable risk factors and non-modifiable risk factors. So the non-modifiable risk factors are things that we have no control over. We can't do anything about them. So that includes like our age. So the older you get, you're more at risk for developing breast cancer. Just being a woman, you're more at risk for developing breast cancer, as well as if you have a personal history of a breast condition that can put you at increased risk. If you have a family history of breast cancer, particularly in first degree relatives, that puts you at increased risk. If you have any hereditary genes, such as a breast cancer 1 and breast cancer 2, kind of called BRCA1 and BRCA2 genes, they also can increase your risk for breast cancer. Also, those individuals who have been exposed to radiation, so, as a child or as an adult, whether it's for cancer treatment or, in the workplace, that can increase your risk for breast cancer. Also, women who have had children later on in life, so over the age of 30, if you started having your periods younger, so less than 12, went through menopause later, all of those different things can increase. And some of the modifiable risk factors include, smoking. And also secondhand smoke, so exposure to that. So alcohol consumption as well. Our obesity or being overweight, our diets, living a pretty, sedentary lifestyle, so not being very active, as well as hormone therapy in some aspects, particularly in women who have passed the age of menopause. So those are kind of, in summary, some of the risk factors.
Okay. All right. So there are modifiable risk factors, things that we can actually change and do. And then there are, what was the other term?
Non-modifiable.
Non-modifiable risk factors. I thought it was interesting that you mentioned, again, that men also get breast cancer. So often this is portrayed as as something just for females, but men can also get it, right?
That's correct. Yes. And men who, so if you have a family history of having a male with breast cancer, you're actually at increased risk for breast cancer.
Wow.
More so than having a first degree relative. Yeah.
Okay. Well, talk to us. What are the symptoms then of breast cancer and how is it diagnosed?
So symptoms, more so if you notice a change in the shape, the contour, the appearance, or the feel of the breast. So if you have a new onset lump or a mass in the breast tissue or even in the armpits, because the breast tissue actually inserts into the armpit. So sometimes even feeling a mass or a lump there can even indicate potential breast cancer.
Okay.
If you notice that the nipple gets inverted, so it means it pushes in, and this is something that's new, that can also be concerning. Changes in the skin, so dimpling, scarring, peeling, flaking, a reddish or orange color are all concerning signs and symptoms. Thickening of the breast, so areas that look different from the rest of the breast also would be some signs of breast cancer.
Wow.
So in terms of diagnosis, so really the only way that it can be diagnosed would be via a biopsy. So how do we even get to the biopsy part? So usually, if you notice anything new, the first thing you want to do is make sure you notify your healthcare professional, immediately. I think that's one of the important things to know, particularly with this being breast cancer month, is early detection is the best prevention, really, in this case. And so if you notice something, go and be seen. So you do have a physical exam, so where your healthcare professional will take a look at the breast and feel to see, what you may have seen, or even if just doing a routine screening, they might find something. The next step would be imaging. So there's different imaging modalities. So we have the ultrasound, and we also have a mammogram. Usually women over the age of 40 will start off with the mammogram. So the current guidelines recommend that we start screening for breast cancer at age 40 and yearly thereafter. And that's more so according to the American College of Obstetrics and Gynecology. The guidelines are a little bit different sometimes from the American Cancer Society. I think what some of us may not know is that there's some evidence to show that women who are African American, so Black women, really should probably consider having mammograms earlier, age 35.
Really? Okay. Okay. So I was just getting ready to ask you. So like 20-year-olds, 25-year-olds, women, they don't need to get screened for this. But for Black women, you're saying likely as early as 35 need to begin that annual screening?
Correct. Yes. So they should consider that. Now, women who are even younger than that, if they have a very strong family history of breast cancer, and that might be more so on an individual basis, they may require screening even earlier than that.
Okay. Okay. And that's just so important. Screening is so important because, like you said, early detection is your friend. The earlier it can be detected, the better it is to treat, the better the odds for survival. Is that right?
That's correct.
Okay. All right. Talk to us then, Dr. Samuel. What can be done? What can I do, or what can somebody do to prevent breast cancer?
So, there's no surefire way to prevent breast cancer, but there are definitely things that we can do to help lower our risk for getting breast cancer. So a lot of these are lifestyle factors. So being physically active. So it means, getting out there, being active at least 4 to 5 times a week, which I know sometimes can be difficult for most of us who live busy lives. But, 4 to 5 times a week for 30 minutes a day greatly decreases your risk for breast cancer.
Decreases the risk?
Correct. Okay. Yes. And also maintaining a healthy weight, eating a healthy diet. So a diet that's high in fruits and vegetables. Some studies even show a Mediterranean diet. So, a diet that has like the good fats, the whole wheat, grains, nuts, legumes, fish, also kind of decreases one's risk for breast cancer. Breastfeeding. So some people probably don't know that even breastfeeding can also, beyond the other myriad of benefits, it also reduces your risk for breast cancer. And, it's an early detection. So, going to your routine screening would be another way to decrease your risk. Also, in terms of alcohol consumption, either limiting that or not drinking at all, and also staying away from smoking.
Okay. Okay. Now, do Black women have a higher risk for breast cancer than other women?
So, yes, in terms of disparities, amongst Black women in regards to breast cancer. So there's different types of breast cancer. So in general, you have the breast cancer that are what we call hormone receptor positive, so meaning that they're more easily treatable with hormones. And then you have the ones that are hormone receptor negative, which are usually more aggressive and are harder to treat. What we've seen is that Black women tend to have the hormone receptor negative breast cancers more often than non-Black women or non-white Hispanic women. And so, usually we're either diagnosed at earlier stages, so younger, not early stages, sorry, at younger ages, and also at later stages.
Right.
Okay. And then even access sometimes to healthcare, if we're not going as we need to, then, we're not getting the treatment that we need. And so we can end up dying more often from breast cancer than our counterparts.
Okay. So this is critical. And this is why, and Dr. Samuel, we're so glad for you just, expending your time to help share this information, because this really is a critical issue for our people, for our communities, certainly for all communities, but in particular, because we got greater risk as people of color. It's critical early detection, making sure that we are going and getting treated, we're going and getting seen or screened, is vital for our people. So I know all of you who have viewed this is important to you. Some of you, many of us know persons that are survivors of breast cancer, or unfortunately not survivors of breast cancer. So this touches so many of us. We want to be sure that we just get this critical information out to you so that you can be aware. That's why this is Breast Cancer Awareness Month. So Dr. Sam, we want to thank you for this valuable information, for your time. We do appreciate what you shared with us today.
Thank you so much. Thank you for inviting me.
Absolutely. Well, thank you everyone for joining us for another edition of For the Health of It, brought to you by Metropolitan Health Ministries. We invite you, ask you if this blessed you, and I know that it did. Like, share, subscribe, pass it on to somebody else so they can get this needed information. Bless somebody if you've been blessed. God bless you, and remember, God wants you to be prosperous and in good health.